The most rewarding thing about my job, meaning being a doctor and in particular being a psychiatrist, is the interaction with people who are in a difficult phase or crossroads in their lives. They need advice, they need support, and that advice and support and serving them is what I find more rewarding, mostly emotionally and then spiritually. Regarding what the patients find more, they value more about me, I think you need to ask them, we need to ask them. But I think that I know what I try mostly not to do. What I try not to do, and I think they value that, is I try not to judge them. I try not to criticize them. What I try to do is listen to them, accept whatever stories or issues they bring into their consultation. I respect their opinion about what they think might be going wrong with them, and I respect their opinion about the choice of treatment they would like to have. And I think my patients really value this. What I value from my patients is honesty, uh, being respectful in the same way that I respect them, and they need to understand what is going on with their lives and to overcome whatever difficulties they have, either with their mental health or a substance use disorder they might have. So mutual respect and trust and honesty are the issues that I value most from my patients. The challenge of psychiatry in general is that we don't yet have specific tests to help us identify the etiology, the causality of the condition that the patient presents with, the person presents with. Therefore, we need to somehow become a detective who is trying to elicit the problems, the difficulties, conceptualize them using the knowledge, the science that we have in our disposal, try to make a formulation, bring it together the story of the patient, what the science might tell us about the cluster of the symptoms or the difficulties that the patient have, what that might mean, and try to lead that to a treatment plan that will be specific for the patient, will be holistic, looking into the patient, approaching the difficulties of the patient as a whole person living in the society, and then implementing that plan. And I think this crossover between medicine, psychology, and art is what makes psychiatry challenging as a medical discipline, as well as exciting. Yes, I think that what I realize that I usually say to my patients at the end of any consultation, that private or NHS, is stay strong. And what I mean with that is the mental health is something that is happening to you. Your mental health challenge is something that is happening to you. It is important to stay up, fighting, trying, not giving up, and use your knowledge, your experience with my guidance to overcome the difficulties. So what 90% of the times I say to my people, to my patients, stay strong.